morning to everybody. And thank you so much for taking out the time and joining us for this very crucial conversation around OneHealth. We are very honored to have Dr. Jitendra Kumar, who's going to be chairing our session today. Thank you, sir, for joining. And the co-chair, thank you, Satya, for doing the honors, is Dr. Satya Dash. So I will hand it over to Dr. Jitendra for his quick comments.
Okay. First of all, very good morning to all of you. I'm very glad to be here today. I think it's IKMC has been a iconic, I would say, conference every year. And every year I see very relevant and deep thinkings and the topics that we discuss is really sometimes I feel eye-openers for us also, from the government side also, because it brings together corporate world, it brings together the startups, and even the government also to deliberate upon some of the most relevant issues facing the biotechnology as such. So today's roundtable topic about redefining the conference theme is redefining innovations for a disruptive world, and it says beyond the blueprint. The whole conference topic itself is a very meaningful one. It talks about whatever we think as a blueprint, what we have thought that, okay, this is a blueprint for success or blueprint for the policies. But eventually in the disrupted world, the world is changing so fast, the geopolitical situation is changing so fast that we have to actually realign ourselves. And that's why recalibrating innovation for a disruptive world is a very apt conference theme. So today we'll be talking about interconnectedness of human, animal, and environmental health. We say OneHealth. And this is something that actually is so holistically involved in our growth and development as a civilization. What to talk about the immediate relevance it has for the health, the environmental health as well as the animal health. That is one. But holistically speaking, as a civilization, as a human race, this is so important topic that if it is not taken care of, I don't think we can survive, to be honest. And therefore, I think what today's discussion is of course about many of the aspects of this OneHealth, but I was pleasantly surprised to note that it is for Telangana. And as it stands, if we talk about one state, Telangana, or any state, suppose we are sitting here, so we are talking about Telangana, but actually every state can act as a microcosm to study this, and then we can apply it in different states. Whatever comes out from today's discussion, we can apply to other states also. I don't think the challenges will be very different in other states as far as OneHealth is concerned. However, since Hyderabad is a innovation cluster, a prominent innovation cluster, we can always have a very good learnings from the experts like you who are sitting here, and we can develop a white paper on that. The challenges in this, OneHealth program is, of course, the climate change, agriculture, and food security. That is the first and foremost it comes to mind. And second is the surveillance. How do we do surveillance and, especially for antimicrobial resistance and other diseases. Of course, AMR is most prominent. The loss of biodiversity is another issue that we have. Because once the biodiversity is lost, actually, it has a lot of ramifications. Climate change and health, and we have health surveillance, and how do we integrate all this information into a policy framework? That also we have to discuss, and data integration across the different platforms, because whatever data we have from the disease side, healthcare side, data from the animal health side, and the environmental side. It has to be integrated properly because different ministries are involved, different offices are involved. And how do we actually integrate in a meaningful way is something that we have to talk about. Obviously, if there is a biodiversity loss, definitely it will impinge upon lot of, it has different consequences. And first of all, we have to recognize, and everybody knows about it, and obviously enough, that if there are species of plants or animals we are losing, then it is creating a disturbance in the ecology, bioecology, and how it impacts. Say, for example, one very good example is the honeybee. If we can do a surveillance and monitor honeybee population in a region, it tells us what is the problem in our ecology, because ultimately these are pollinators. And if, for example, if there is a lot of chemical, usages in the region, in the agriculture field, etc., more and more chemicals mean less and less honeybees. And if honeybees are less, you get less yield of plants, mostly cross-pollinated ones. This is actually very obvious. And the other effect is, if there are a lot of chemical usages, then their biological control agents also get disrupted. One insect trying to act as a biological control for some other insect, the whole ecology, whole speciation, everything gets disrupted, and it has catastrophic effects on the environment. And if we have a biodiversity loss, say for example, one species of plant is lost, and it has a medicinal aromatic value, and we may not know whether it has. Sometimes it's proven that it has, and we lose it. Then the source of new drug development is lost actually. Okay, and many of these plants we do not know what value they have. So definitely, loss of biodiversity has this ramification also. There are some biological, agents or bioindications, indicators we say. Honeybee, one example I gave, but say earthworm. If the earthworm population is less affected, because of agrochemicals used, then the health of soil is affected. We know that health of soil definitely will get affected. And if the health of soil is getting affected, then the whole set of, ecology of the soil is also getting affected, and the crop yield is getting affected. So you talk about air quality, you talk about water quality, you talk about loss of species, you talk about the ecological disturbances, all is integrated in a human, in OneHealth. And all this will affect the human health actually. So if human health cannot be studied in isolation, the crux of the issue is that we cannot study human health in isolation. We have seen pandemic COVID-19, how it actually, it had a zoonotic source, and how actually it came into, the horizontal gene transfer happened into humans from bat, for example, in this case. But there are many zoonotic cases which can happen if there is a biological, ecological disturbance. Okay, so therefore, if we do not study in interconnected manner all these things, we may not have any permanent solution for these things. They'll keep on happening because connectedness between animals and humans sometimes becomes very, very prominent if the biological diversities are lost. So there are many issues which comes into picture. Now, how do we actually address this? One of the best ways to address this is that we develop policies in such a way that whole, ecologically and the animal health and the human health, etc., all holistically it is seen. as a population, as a policy. And one of the mechanisms is to monitor ecosystem health. This is the first thing that we can do. Monitor ecosystem health. And ecosystem health, as I said, specific bioindicators are there. Bioindicator species are there, like dragonflies, honeybees, earthworms, etc. Second is predicting and preventing disease outbreaks. This is the role of surveillance I'm talking about. So predicting and preventing the disease outbreaks is something that government has to undertake in a very, very holistic way. And third is informing the conservation efforts. So this is also important to identify key target species and ecosystem for conservation. What are the species and ecosystem that we want to conserve out of whatever indications that we have, whatever data we have collected? Now we have to focus on species that has to be preserved and conserved. That is to actually get them into balance. One of the very good examples has been demonstrated in Delhi, in Yamuna River, across the different regions of Delhi, where the biodiversity disaster was there. And one of the professors, Dr. Babu from Delhi University, he actually rejuvenated the whole biodiversity, and it was demonstrated so well. So that is the kind of effort that we need to actually have in all the states, in all the regions, to actually make sure that our country progresses in a very, very healthy manner. And the last one, which I think is the assessing health risks, actually. So this also is important, because unless we assess the health risk, it may not be appropriate for us to derive any kind of conclusion in this. In the last, I would like to say that all these efforts would not have any commercial angle at the outset. Okay, so if I ask any companies or startups to undertake these measures, I don't think, because they may not have a business model for that. They may not want to work on it. So ultimately, government has to initiate such programs in a policy framework where they enable these startups and industry to take advantage of such situation, or take advantage of the opportunities that have been created through that policy framework. For example, if there are forest products and many tribal population and many human settlements are using these forest products, which has been the case in our country for long time, because these are forest communities and tribes who have been actually preserving the culture as well as they are utilizing the forest products. One example I'll give is somehow, how it has been affected through different laws, adverse laws. So forest laws have been, from the time of, British Raj, time when Britishers were here, they had, initiated these laws to exploit the forest resources. And that had destroyed the whole ecology. You cannot imagine how much wood and forest was destroyed to actually, fulfill the ambitions of industrial revolution in UK. Trucks of, through shipping, lot of trunks of very precious wood material were actually sent to from our country. And they created laws where many tribes cannot use this, and there's so many laws which were, and the irony is that even after independence, because most of the legal system actually was, came to us as a legacy of the government, British, and we continued that. And there were several amendments, but actually speaking, these laws still, I think, are very, very inhibitory. So these kind of government, whatever laws are there, will actually not help the, biodiversity for sure. So taking cognizance of all this, government has to come up with a holistic plan to see that biodiversity of the country, of the region is maintained. India is a hotspot of biodiversity, and including its population, which is genetically varied, because that also is a biodiversity. You know, it has a lot of genetic alleles, genes which are very, very unique, and it can help you physicians or doctors or policy, you know, hospitals to identify biomarkers of unique character. So all said and done, our country having this huge wealth of animal health, ecological wealth, and human biodiversity, including, I think we are having a very prized possession, and we are not able to recognize this. This is something that we have to understand. So today's discussion will deliberate upon these points, and you all are experts in those areas. I just jotted down some of the points which came to my mind. But however, I know that we have academicians here, we have experts in this area, and definitely we all can benefit from your expertise. And as a government side, I can assure you that I'll take many suggestions from here and try to see what kind of policies we can create. As you know, BIRAC is involved in nurturing startups and also helping industries, and even academic projects also we do if there is a translational angle. And we create programs, actually it's not just funding. We create programs where there is a need. And creating programs means that we have to understand all this, because we cannot create such programs if we don't understand. So what I would like to have a discussion around is what are the key challenges in this area, how to solve this, and how do we create a structure or mechanism where innovation flourishes in this region. Okay, so I'll end it here because I think we are already late, but I would invite comments from my co-chair, and then we will open for key discussions and the experts, and then we'll open for others. Thank you. Thank you. Over to you.
Thank you, Jitendra. First thing, to Dipanvita, she's missing here, but to her, to IKP, Dr. Jitendra Kumar, my good friend, of course, Bindu, Nishal, and all of you for taking time to come here. I'll even work out of Berlin now, but hopefully in a few months' time it will be more of India. Previously, I wear 3 hats, so just so that you know. One is I'm the president of strategy for Big Tech, which is a R&D arm of MolBio. If you have heard of TrueNat, during COVID, we do TrueNat. It's a PCR, RT-PCR platform. The PCR happens on a chip. I'm the senior advisor at Blockchain for Impact, and I work with 2 amazing leaders, both very young. My founder is based out of Dubai, Sandeep Nailwal, and my CEO, Dr. Gaurav Singh. He is a clinician. And Sandeep's philanthropy during COVID and post-COVID, I've helped them really look at biomedical research and innovation. So Sandeep and Gaurav have committed close to $200 million to India, and that's what we're trying to see where we can instigate, support biomedical research and innovation. Last 3-4 years, we have verticals in public health. We built verticals on research labs, funding projects, verticals in incubators, and now we're doing one for startups. And biomedical research is very relevant for what we're going to talk. I have my good colleague here, Dr. Ramnath Balala. If you raise your hand there, Ram. Yeah, right. He is a program director for public health and, of course, looks into OneHealth. So please do speak to him. And I might invite him to speak a little bit what we do later on. And the third is I sit on the board of Venture Center, which is the incubator out of Pune. And so these are the 3 formal roles I do. The best thing about being the co-chair is that the chair has said everything, so I don't need to expand. I was thinking, and thanks to Bindu for inviting me to co-chair here, we're all related to ecology. Whether we like it or not, whether we think we are or not, we are. My relationship to ecology stems from my family itself. My father is an ecologist, 87-year-old, trained in Calgary in 1970, came back and to do vermitechnology, turtle migration, all of that, chose Sambalpur to be the place of his karma bhumi. So I grew up in Sambalpur, He was a professor and vice chancellor at that university later on. Second is anyone who is interested in the idea of what we are as a species. And our lens tends to be more anthropogenic. We tend to look at everything through the human lens. And I've discussed this topic with my good friend, Professor Karthikeyan here from CCMB, is that you know, whether it is our old traditional knowledge or even if you read Rachel Carson's Silent Spring, it does point to what we are doing to the environment here through our activities. I mean, don't ask me about my carbon footprint. I fly to India every month. And so while I smile about it, of course, that has an impact on what we are doing. Just so that we are running late on time, and I think we'll go around the table, just a very short introduction. What Chair, my good friend Jitendra mentioned, absolutely. So I'm looking to hear, I'm a novice, what are your thoughts on what happens when ecosystems get damaged? They are our buffers. How do we make sure that the buffering continues? What to do with that? Surveillance, generally we think about human surveillance, but I don't know what's the latest about wildlife surveillance. It's very fragmented. I get to hear what we're going to do there. My father used to mention something called ecosystem services. I wonder whether you've heard of this. Some of you may have heard of this term. I'd love to hear your thoughts on that. And of course, AMR in aquatic. Another good friend, Divya, is here. She runs a wonderful company called Genome Soil Health, the chair has mentioned. But finally, it is the governance. Everything and anything comes down to leadership and governance. We can do 5 roundtables in the next 2 years. But finally, what is the actionable thing we want to do? And how do we make sure that when we do a roundtable again on OneHealth, it's not the same topics we're talking something about that some actions have happened. So with that, I'll stop here, Bindu. And thank you again for inviting me.
Thank you so much to both of you, Dr. Jitendra and Satya. I think they've set a very good stage. And I should begin by saying that we were hoping Dipanvita would join us, but she's just engaged somewhere and she'll try to join us as soon as possible. Me and Vishakha are going to be your session coordinators. And let's go by the program so that we have ample time. I don't want to spend time talking about us and the work that IKP is doing on OneHealth. But very happy to talk about it. I'm very happy to see several of our OneHealth collaborators, like Shannon, Dharma, Raman, a lot of my collaborators are in this room. And we hope that at the end of this roundtable, like Satya mentioned, there are some actionable outcomes. And the next time we meet, and there is something at the end of the roundtable that we would like to probably share. It's still at a very early stage. But as Dr. Jitendra mentioned, we are trying to come up with a model that can be adapted, a consortium model that can be adapted to different states of India. So in the end, everybody is channelizing their OneHealth efforts. And we have Arvind from RICH. He will talk about it, being the PSA's arm for all work related to OneHealth throughout India. So with that, I would like to start by, maybe we can have a very quick round of introduction. We will start with Professor Anil here. 30 seconds each, your, who you are, where you're coming from, and what is your role for OneHealth. Thank you.
Hello. Yes. Good morning, everybody, and thank you, Bindu. I'm Anil Kaul, as mentioned. I'm currently the Vice Chancellor of Mallaradi Vishwavidyapeeth in Hyderabad. And I have returned to India after about 35 years in the US. I trained as a physician, as a dentist, as a public health professional, but also involved in developing new technologies, mostly diagnostics. Before coming to US, before returning to India, I was running a program for USDA, developing a dashboard for surveillance, active surveillance, using a lot of data sources, including weather sources. So that's my background, and my role in OneHealth has been I developed a program in US at Oklahoma State University, which is a land grant university, basically agriculture and veterinary sciences along with health. So we developed a OneHealth park where we brought in all the players together under one roof, and that brought a lot of synergy. Here I moved last year, and I joined Public Health Foundation of India as the director for IIPH Hyderabad, and also as the vice chancellor for the new deemed university until June of this year. And there also we had a first workshop on OneHealth, where that whole road, Rajendra Nagar, has a lot of agriculture, veterinary sciences, and I actually proposed the name OneHealth Road for that, because
I always think of that when I'm on that road.
Yeah, and unfortunately, the people leading those institutions, they never talk to each other. So last year we had the first conversation, and we opened those silos and we started conversation. A lot of synergy can happen, and I personally feel that, not that I'm in Hyderabad, but I think a lot of things can happen in Hyderabad, because I see that synergy in Hyderabad. I'll leave it like that. Thanks a lot. Thank you.
Good morning, everyone. I'm Nagendra Hegde from the National Institute of Animal Biotechnology. A very brief background about myself. I have a veterinary background, bachelor's, master's, and PhD in veterinary sciences, mostly a virologist. But then I worked also on the human side, working in virology and immunology before I joined Bharat Biotech, and worked there for about 11 years. So I have some industry experience as well. And then I joined this institute about 8 years ago. I still work in infectious diseases, but I also am one of the main persons involved with DBT's OneHealth Consortium.
Yeah, very good morning to all of you. I am Dr. Ranga Reddy. I'm basically a physician and trained in OneHealth and also the public health policy making. So I won't talk about myself. I would probably talk about the organization which I am representing today, that is Infection Control Academy of India, which is working at all the levels. At a global level, we are part of the Civil Society Action Group, and also the so-called AMR platform, which is basically devised by FAO. And at a national level, we are part of a National Action Plan. At state levels, we are part of Andhra Pradesh and Telangana state action plans. As member of this organization, I am currently been given the role as expert advisor for Telangana action plan, which is in making. And Bindu has been a good part of it. A lot of other friends are a good part of it. From today's session, I have a lot of expectations. Probably I would come back to that, some of the suggestions to Dr. Jitendra and other colleagues, who are sitting on the policy making bodies. Thank you very much.
Good morning to everyone. I am Dr. Raman Muthuswamy. I am currently working as a dean in School of Public Health along with Dr. Anil Kaul. We are from the same institute. So I am basically a veterinary microbiologist. I am from Tamil Nadu. So I was a faculty in Tanuvas Veterinary University, and I was part of a novel partnership initiative of Department of Biotechnology. It's called Translation Research Platform for Veterinary Biologicals. So it's a unique platform created in Chennai, and they have a huge investment thanks to DBT. And I was part of development of diagnostic, especially for OneHealth disease like tuberculosis, brucella, anthrax during that period. And I had been part of several antimicrobial resistance projects, and I led a project which is funded by Global Challenges Research Fund, cross-council funding from UKRI. I led the project from India, which is just completed in 2024, and the lead investigators are Royal Veterinary College. So currently I am trying to work on zoonotic diseases, because now being a Dean of Public Health, and I'm trying to connect with people from Hyderabad. And in fact, we had a meeting in July, about 2-3 months before, and we had a OneHealth collaborative, me and Dr. Srikanth from Access International we organized, and of course we had good support like from Dr. Bindu and others. So we are trying to definitely continue this One Health collaborative to start from Hyderabad. So thank you for the opportunity, and I'm also looking forward for this innovative program. Thank you.
Good morning. I'm Shetty. I'm a One Health practitioner. I'm a part veterinarian, part epidemiologist, part wildlife biologist, and part accidental diplomat. Previous to what I'm here, over the past 20 years, from California, from Bangalore actually, to California to Paris, and while coordinating wildlife health networks across different countries, almost 183 countries, I realized one simple truth. I started off treating tigers in the Karnataka Forest Department as a veterinarian almost 20 years ago. And over the last 20 years, I realized that treating tigers is the easy part. What's harder is getting people to come together in disciplines like One Health from different perspectives of work, whether it's just to share data or in the larger landscape to prevent pandemics as well. At the University of California, Davis, I used to work in the Emerging Pandemic Threats Predict program. And over the span of about 10 years, we spent about 200 million US dollars until we realized how much we still need to understand One Health because we were not able to prevent the COVID pandemic. There's a lot we don't know about biodiversity. There's a lot we don't know about wildlife health. There's a lot we don't know about a lot of other data structures or data that we need to bring together with humility to address even data sharing or to prevent the next pandemic from happening. And later in Paris, I coordinated wildlife health networks and worked on emerging diseases. And there we built the first global network of wildlife health collaborating centers. And we also created the first global watch list for emerging diseases. And today I'm convening the World One Health Association. It's still in formation, where we're trying to build innovation, certification, and collaboration platforms that link national coordinators with global policy and turn science into policy and vice versa as well. Take policy, global policy down to the national levels and subnational levels as well. With the idea that people, animals, and ecosystems are considered equal, and we look at it from different lenses, but the health of one entity is closely related to another entity and all together. Thank you. And I'm looking forward to this session as well.
Yeah, good morning everyone. My name is Dr. Shrikant Kalaskar. I am also trained epidemiologist and a medical doctor. So with background with One Health, so I largely worked on surveillance. I started my journey with surveillance, I think in 2014-15, where I was involved in a project called a GHSA. If I guess everyone has heard about it. GHSA is Global Health Security Agenda by CDC. So at that time, we were very focused on training epidemiologists, the RRT teams, on maybe identifying and managing anything if something like COVID has stuck. So we started from there, but yeah, we could not take it much forward because no one was serious at that point in time, including state of Telangana, just to mention here. But yes, we have come a long way now. It's a decade to that particular project and that particular agenda. So with current role, I am with Access Health International, working as a technical head, public health and capacity building. Along with that, I am leading the vertical of surveillance with the platform which we have created as accessible as a secretariat, which is called as Global Learning Collaborative for Health Systems Resilience. Again, post-COVID, we have started this platform, and as I guess Chair and Co-Chair has mentioned, that we do a lot of discussions. So on this platform, we do a lot of discussions. We have annual conclave since last 3 years, and we have been discussing various topics, various thematic areas. And that's where the last meeting which we have organized with Mallareddy Vishwavidyapit on One Health has emerged to this particular roundtable, and maybe hoping for having a Telangana consortium for One Health again. So yeah, so I think that's where my role belongs to surveillance and One Health, and looking forward to more actionables as Chair has mentioned. So with this, I will hand it over. Thank you.
A very good morning. I'm Kalpana Shastri, and I come to this roundtable with the experience in the agri sector, agri-food sector. I've been engaged, part of the ICR system for almost 3 decades, and I have been engaged in agri policies, innovation management, had the pleasure of looking after and actually bringing up 2 agri-incubators right in Hyderabad here, which are AIDEA and AGA, both doing in different way. So with this background in agriculture, it's a pleasure today because one job I had done for the task forces under the T20 of the G20 presidency, and our one of the recommendations was actually to bring in One Health concept. It had come, and it's a pleasure personally to me to see that I'm part of a initiative from here. It's also a pleasure to see that at least what we write in the suggestions to the Government of India are actually getting actualized today. I quite agree with the chairman that maybe state-wise we should take it forward. And you would also see that though the chairman had said food security and climate is the start point, I am perhaps the only person with agri and food background in this, which also means that somehow those silos have to be broken, and we have to envelop many, many sectors into this initiatives. Thank you.
So hi everyone, I'm Shannon Olson. Dr. Satya will be happy to hear that I'm like his father. I'm an ecologist by training. And I moved to India a little over a decade ago to study Indian ecosystems and how humans are having an impact on them. So I've studied things like air pollution and climate change, and I particularly work in the agricultural sector, so I have a background in food systems like you. And Dr. Jitendra, I might also mention that to your point, I was part of writing the DPR for the National Mission on Biodiversity that India has, that has been approved by the ministries but still is not funded. So perhaps through BioRac we might be able to find financial incentivization for the government to support these work in biodiversity. Actually, all of that was the reason that I founded something called the Eco Network, because I came really frustrated that people on the ground in villages, in companies, and even in our governments are not really valuing the importance of our ecosystems and the really existential nature of climate change and the effect it's having. So the Eco Networks really works now across 46 countries. We have about 2,600 members now. We were initiated by the Principal Scientific Advisor in 2020. And the purpose of the Eco Network is to really try to do what Dharmavir was mentioning, which is a really hard job, getting people to work together across different sectors, across different backgrounds, across different value systems to try to solve these problems on the ground for people in villages and cities and in forests in India and also across the world. And my hope is working with Bindu, working with Raman, working with so many people in this room, that we can really realize that One Health is an issue that is not something that we have to look forward to in the future and plan for, but it has already been happening. And it is happening on the ground right now, and I'll talk more about that, but I'm incredibly happy to be in this room with all of you. So thank you so much.
Very good morning to all. My name is Dr. Jagdish Kapugante. I'm a scientist at BRIC, National Institute of Plant Genome Research. I mainly work on nitric oxide signaling for the food security. As a part of, previously I was a basic researcher, but recent years I translated some of my basic research into translation, where we have founded a startup, Fruitech Private Limited, which is a National Startup Award winner in post-harvest category. We see that India is losing approximately 2.5 lakh crore worth of fruits and vegetables, and because of the fluctuation in the prices, the poor people are not getting enough fruits. For example, during the transportation of the fruits and all, they're getting damaged. Finally, the prices are increasing. So in this way, we recently contacted Dr. Bindu. We had a discussion on that. We have developed innovative products throughout the supply chain, at farmer level, transportation, storage, and also export-import to reduce the wastage. At the same time, recently we also started work on another innovative product development, that is to reduce the nitrogen oxide emissions to mitigate the NOx pollution, which is also impacting the OneHealth. So with this basic and innovative research, and then with the expertise in the food security, and I'm very happy to be part of this roundtable discussion. Thank you.
I think we should also congratulate Jagdish. He's the recent winner of the Shanti Sarup Award winner for 2025.
Okay. Good morning. My name is Rahul Narang. I am Professor Microbiology, All India Institute of Medical Sciences, located in BB Nagar, Hyderabad. I am trained microbiologist, both MD as well as PhD. I worked for a long time on tuberculosis, setting up laboratories across Africa and south of India. Then 2014, Dr. Kotoch, Director General of ICMR, that time asked us to work on zoonosis along with Indian Council of Agricultural Research, and we led the first project that eventually led to establishment of National Institute of OneHealth in Nagpur. In Hyderabad, we are part of all the networks Indian Council of Agricultural Research All India Network Program on Zoonosis and OneHealth. We are regional coordinator for OneHealth under National Centers for Disease Control. We are also VRDL and setting up BSL-3 laboratory under ICMR. And now we are also part of Government of Telangana as the committee along with Dr. Rangareddy. So trying to do something on OneHealth along with other organizations. Thank you.
Hi everyone, I'm Raghav. I'm Director Portfolio at India Health Fund. So we are set up by the Tata Trust to fund healthcare innovations to address the market failure within infectious diseases. And since then, we've expanded to supporting innovations within human antimicrobial resistance, and now looking at innovations within the intersection of climate change and health, especially focusing on health adaptation. I will bring you a couple of tangible examples of how we're looking at early warning systems and digital public goods that are being developed within a couple of governments in the state of Rajasthan and the state of Karnataka. To Dr. Jitendra's point, startups and not-for-profit organizations who are developing these machine learning based digital public goods, but I'll save the details for when the program runs through. Look forward to the discussion.
I'm Karthikeyan. I'm Chief Scientist at CSIR CCMB. I'm an animal ecologist, and I have a few very main projects that I run. One is on a pandemic that has affected the amphibians, and it impacted globally. And I started work much before the COVID pandemic. So the inspiration was not COVID. So we have been monitoring for the last 8 years in a site in Maharashtra. And we are looking at the impacts in the Indian fauna. And that has been a very learning experience. And I also work on snake bites. And having collected some epidemiological data in Telangana and looking at the severity of the problem and also understanding the gaps that can help in bridging the mortality and morbidities that are caused And the third aspect I'm interested in is human-wildlife conflict, which is a very big problem in rural India, where we have people incurring losses which are disproportional to the profits that they are gaining from agriculture. And this problem also has an One Health dimension. Thank you.
A very good morning to everyone. I am Shilpi Kochu. I am heading the Business Development and Communications vertical at BIRAC. We have Dr. Jitendra Kumar as the MD BIRAC chairing this session today. So this division takes care of the strategic partnerships and scientific communication. This means bringing people together, and I just realized it is harder than treating tigers. So that's something I'm trying to do. Brought in close to 15-20 new partners. We have like BFI as one of the recent partners. India Health Fund is one of the partners. We have a representation of startups and partners and ecosystem stakeholders. IKP is a long-standing partner for us for last 12 years. So that's my role at BIRAC. And both the pillars happen to be very critical for implementation of a multi-consortium kind of a project, which is One Health. So that's what I do at BIRAC. Thank you very much.
Good morning all, and firstly thank you to the IKP team for inviting. So I am Arvind, so I represent Research and Innovation Circle of Hyderabad. So I take care of the startup and ecosystem building activities. So Research and Innovation Circle of Hyderabad is an initiative that is formed by state government in the year 2017, to act as a strategic convener, meaning we bring all the stakeholders together, be it industries, academic institutes, government bodies together. We identify the regional challenges that are existing, and with the experts from the institutes, industries, etc., we try to bridge the challenges that are happening. And also, in the year 2021, Office of Principal Scientific Advisor to the Government of India came up with this science and technology cluster concept. So, having been in the ecosystem from 2017, in the year 2021, Office of PSA gave us the status of a science and technology cluster. So from 2021 onwards, we have been actively involved in various public health projects, and currently we are taking up the priorities from the states, and closely now we started working with GHMC and some of the initiatives like Mosi Rejuvenation Project and GHMC to reduce the vector-borne disease. And I think some of our team members have been actively discussing with few research institutes over here in terms of the projects that are happening in the vector-borne diseases. So I'm happy to say that under Office of PSA is also leading the National One Health Consortium, and which is coordinating with most of the 15 departments in the central government and state government. So we act as a bridge between the state and center as well, and take up the projects from here with the aim of center too. So I'm happy to discuss further details related to vector-borne diseases project that we are doing with GHMC right now, and also Mosi Rejuvenation Project. Thank you.
Good morning, everyone. I'm Divya, co-founder of Denome. Denome is a synthetic biology startup who's been thinking about One Health before even our country had a One Health initiative. So I'm proud to say that. But more than that, I'm really honored and stoked to be in the presence of visionaries, dignitaries, and leaders who have, as Satya and Dr. Jitendra is talking about actionables, are actually doing those actionables as we speak. As everyone was going through the introductions, I can see that they're either leading One Health initiatives or have been working in One Health actively, or have been contributing or will be in the future contributing significantly to it. So I'm super excited to talk about what we do at Denome. Briefly, we are building molecular detection technologies, the world's first technologies that are completely indigenous and that can be taken onto the field for surveillance in One Health. That means you're talking about animal health, human health, plant and agri health. And also one bit of news from our end, we recently launched one of our aquaculture disease detection products with ICAR SIVA, so Indian Council of Agricultural Research SIVA, at the DAA conference recently. And we're also working in a GAMRIF project where we're actually doing environmental surveillance with our platform on AMR in aquaculture. So really excited to be in this panel, and thank you, Dr. Bindu and IKP team for having me here.
Good morning all. Myself, I'm Dr. Sridhar Kothagota. I am representing Indian Immunologicals on behalf of my Managing Director, Dr. Anand Kumar. I am here today and I happy to see you all of here. As a true OneHealth company, we have both women as well as animal, and also we are into aqua and poultry vaccines. Anything proof of concept, if you wanted to commercialize and affordable to the end users, we are working on various platforms, and happy to work with all of you. Thank you so much for this.
Myself, Rajeshwari. I completed my MSc Microbiology from Andhra University, and since 3 years I am working with IKP in life science incubation as a supporter. Thank you.
Yeah, that's it. Thank you.
Hi, this is Praveen. I'm a founder and CEO at Arthrobiotech. We work with insect biotechnology.
Thank you.
Thank you.
Okay. Vikas.
Hello everyone, I'm Dr. Vikas. I work as a Chief Innovation Officer at Mallaradi Vishwavidyapith.
Wonderful, thank you. All right, quick 10 seconds. Oh, my CEO is here, Dr. Gaurav Singh. Okay.
Hi, I'm Dr. Gaurav Singh, CEO of Blockchain for Impact.
Lovely, thank you.
Pavandar from CVJ Center, Kochi.
Sonia.
Good morning, everyone. I'm Sonia Gandhi, currently heading the newly created Division Regulatory Affairs and Policy Advocacy at BIRAC.
Good morning, everyone. My name is Dr. Ragadipti. I'm the founder of For Her Wellbeing, which deals with women health issues.
Good morning, everybody. My name is Jagdish. I'm a Chief Operating Officer at Federation of Asian Biotech Association.
Hi, this is Sridhar Ramanathan. I'm the CEO of IKP Eden and the Senior Vice President at IKP.
Hi, I'm Anand Srivastava, Scientist at NIAB.
Pankaj Suman, Scientist at NIAB Hyderabad.
Oh, I love that.
I am Ramnath. I'm from Blockchain for Impact. Yes. I'm Ramnath. I'm from Blockchain for Impact. Yes.
Okay, you may not have seen walking, talking co-chair, but we'll just go ahead. Okay, Chair, you can continue.
Thanks, my co-chair, for helping me out, the quick introductions and all. So, how the organizers have planned the session is, so first would be loss of biodiversity surveillance and health risks that we will be talking about. And the lead discussants will be Professor Anil Kaul and Dr. Nagendra Hegde, who for 10 minutes will delve into this topic, and then expert dialogue where there are 4 speakers, Dr. Ranga Reddy, Buri, Dr. Raman Muthuswamy, Dr. Dharamveer Shetty, and Dr. Shrikant Kalaskar. Okay? So after that, we will have an open round of discussions, and then we'll conclude. So let's start with the lead discussants, Professor Anil Kaul and Dr. Nagendra Hegde. Over to you.
The loss of biodiversity is critical for any initiative we want to take in OneHealth. I think one of the things is which happens immediately is loss of clean water, clean air, and also it impacts food and medicines also, because as we know that many of our medicines come from the plant source. I think one more thing which is, as an infectious disease person, I think one thing which we are very aware of is lack of biodiversity increases infectious disease outbreaks. I think that is also very important to keep that in mind. And food security, I think there was a mention about food security. I think biodiversity also impacts our food security. And of course, it impacts the economic consequences. There are economic consequences for all of this. So I think that it's a multifactorial impact, loss of biodiversity, and everything is interconnected. And I think if we don't take an integrated approach, I think we may be focusing on one sector or another sector. I think we may not be able to address all the things. I think we have to work across disciplines, multidisciplinary. So that's what I feel. And I will ask Dr. Hegde.
Thank you, Dr. Kaul. That was quick, and I think most of the platform has been set forth by the chair and co-chair, so I will only include a few things in addition that I think, but before that, I'll give a little bit of personal touch to the OneHealth. So I come from the Western Ghats. My parents are still there, and I still remember when I was a kid, my father was actually going around in the hills around my house, digging trenches. And I really didn't understand why he was doing that at that time. And he used to say, rainwater, rainwater, and all these things. So now we know that, why he was digging up the trenches. And this was public place. This was not even our area. So he was trying to do it for the betterment of the livelihood of the people. Now, just today, I got a phone call from my father saying that there's a little rivulet which runs through nearby our house, a little bit away, actually a couple of kilometers away. They are trying to build a dam to take the water to a city that is about 250 to 300 kilometers away. We still don't know whether that's for drinking water or agriculture. Now, having done all that, he feels very sad, and he says that our house will be submerged if the dam is built. So this is the sad state of affairs, and I wanted to give a personal touch to this. And I can say that we sitting here and talking and making policies is all great, but I can tell for a fact that villagers are the ones who do really work on OneHealth and work on circular economy. They do a lot of things that we actually talk about, but they implement it, personally with their own efforts. So that I don't want to talk much about biodiversity because I think it's been talked about that they, provide buffer zones for everything we do or take it for granted. I just want to talk a little bit about surveillance. Surveillance has been a big word that, even now people are talking about genomic surveillance. You take wastewater and try to see what is there. Are there variants? Can we somehow come up with the next, pandemic and things like that? I just want to flag that I'm sure my friends who know epidemiology a little better than me can tell that surveillance is not the same as prevalence. Most of what we are looking at is at prevalence and outbreaks. Surveillance is a very structured way of looking at what might be happening in specific areas. And if we do not know what is the prevalence of certain infectious agents or diseases, we cannot really do surveillance. So if we don't have the data for prevalence, which we were trying to establish through the OneHealth consortium project that we are doing for DBT, it becomes very difficult. So random sampling and looking at pathogens is not actually surveillance in my view. The additional thing is when you look at the existence of genomes and pathogens, that doesn't tell you the disease burden. In many cases we know we get infected with pathogens and 80% of the times we don't get disease. So there has to be a very strong mapping of the diseases that we have in this country and what are we dealing with in terms of infectious diseases and pathogens. And surveillance and disease burden have to go hand in hand. And as our country is very vast, it cannot be one size fits all. So each region has to focus on what is important for their place and region. So that's a few things I wanted to highlight. And the other thing I wanted to talk about is that, there was mention about tigers, and we're all tigers in our own field. And with tigers comes territoriality. So we stick to our territories, and we have to somehow cross, and maybe we should become lions, because lions actually build prides better than tigers do with their social systems. So correct me if I'm wrong. So I think we should become lions, not tigers in our field. So I'd like to provide a few views about solutions. These are known things that everybody talks about. One is, as already said, robust cross-sectoral working, but especially early warning systems that cut across different sectors, not just generating data, but also looking at the warning systems that are generated. And there has to be a single window warning rather than each sector giving its own warning to different sectors. The second is that there has to be, I mean, we all understand this, there has to be a strategic research investment, and this investment has actually needs to drive cross-sectoral collaboration, and individual things will help. For example, development of diagnostics, development of a treatment will definitely help. But I think if we really want to go towards the One Health path, we have to fund things where people are interacting with each other, not individual units. Public and policy engagement, we know this is a lacuna that we need to deal with. Another important thing that has already been flagged is the integration of traditional knowledge. The local people that they do. Many times as veterinarians, my friends are here from the institute, we go to the villages and find out that they're using certain herbs for certain diseases, and we do not know how they work, but they work. So these things need to be integrated into our current knowledge. And of course, private sector engagement. There's a lot of people who are coming up now to work on One Health. So I also hope that big companies who have been there for several years also can contribute through sustainable development, and maybe put into the pot of funding in terms of CSR and things like that, so that people can work together on this. Lastly, we should have nature-based solutions. We can't have things that are, working only in these kinds of buildings. For example, restoring forests and wetlands, then promoting biodiversity in agriculture, including forest diversity. We can't have, I know in my area there's monoculture of eucalyptus and acacia. That needs to stop. I know they are cash crops, but that needs to stop. We need to have more diversity, including in forest development. And finally, we need to have positive incentives for sustainable practices and environmental stewardship, especially in big pharma. Thank you.
Thank you, Dr. Naik. We'll move to
Dr. Rangar.
Yeah. I would like to just continue on the thought which Dr. Hegde has mentioned, that if we really want to have the One Health dimension to be seriously considered, then we can not be reactive. We had to be proactive. We had to be predictive. And all what we had to plan for One Health definitely had to start with the surveillance, right? I don't want to use any negative words like, we are far away from getting even the surface scratched on the surveillance data. But I think, some work is started, but it is for all of us actually to strengthen it. There are a couple of things, I would like to bring to the table. I just came back from WHO headquarters, where the 2025 GLAS report was, announced. And, if you look at those numbers, you definitely feel very depressed. But on the other hand, I think, instead of getting depressed, we had to look at what is that we can do in order to change the situation, where year on year, we are having something like 20 to 40% increase in terms of the resistance which is happening for all the major pathogens. If we talk about our own Indian data, you all know, I think, we can't take that, unfortunately, as a basis to form any policy. Forget about actually national action policy or the local action policy. One of those expectations, what we all had to set through this meeting is, probably when we talk about the National Action Plan, which is already there for 10 years, which has not moved much in terms of actions, and the state action plans still only 7 out of 28 states and 8 union territories getting, some kind of action plan written, which is need to be implemented. Participating in Andhra Action Plan and its implementation, one of the major challenges what we found, the first and foremost was there was no baseline data in order to start working on, what to focus on, what are the priorities need to be set in. And, we started doing something, and the surveillance data and the surveillance systems are something, which cannot be afforded by a state government. And from there, a request comes to you, Dr. Jitendra. We have, at a global level, the GLAS. At a national level, ICMR is annually publishing a report on, what is happening in India in terms of the resistance. There is a WhoNet, which is a system where the clinicians bring in their data into the system. But there is no universal system where we can capture the data from all the sectors. And when we were planning initial action plan, committee, one of the things what we said is Telangana as a state which has got not only CCMB, NIAB, IKP, and all these organizations which were forward-looking, but also a very strong digital presence with all the top 100 global companies actually having the presence here. We thought we will start with that. We will start creating a system which is a very easy to kind of interface for the people, very intuitive for the users in order to bring their data and create out of that a dashboard, right? We tried this in Andhra, but it did not really work out because there was a lot of resource required. So probably, I can request probably BIRAC and other organizations, probably you could look at it as a national project, which can really give a fillip in terms of taking the state action plans, really getting started, and the implementation is going to be really good. I think, my time allotted is over.
Only AMR, or your discussion was this dashboard for AMR or for many other?
Yes, sir. To start with, probably AMR, right? Because whenever we talk about OneHealth, I think, it is AMR centric at the moment. Of course, at later stage, once we solve the the hot potato and the biggest issue on the table, probably we can take this initiative to address the other issues too. I'll just, in a moment, actually, I will stop. I know that, the time is...
Yeah, we're running late, so I'll
but
just request
you said, let us get something from this initiative, not just taking the air, but some concrete proposals. So I have some concrete proposals. Second thing is, I said we just started TAPCAR, that is the Telangana Action Plan for Containment of Antimicrobial Resistance. The core committee is formed, the subcommittees are getting formed, and we welcome actually the BIRAC and other organizations, who can bring in tangible benefits, moving the needle from planning into implementation. I would stop here. Maybe during the tea time or coffee time, I will bring in more perspectives from the ground.
Lovely. Thank you, Dr. Reddy. May I request the permission of the chair that we just stick to 2 minutes, and he has just empowered me to be the timekeeper.
Yeah,
so I'll let you know. Okay.
So I would suggest that the surveillance, especially in the food production cycle, is very much lacking, whether it is animal foods or marine or plant origin, because most of the problem arises there, and like the man's greediness to go into forest, disturbing the biodiversity, it impactfully affect all the food cycle. And I don't know, though we have a well-structured slaughterhouses and place where the animals has to be slaughtered, nothing happens in reality. Because while I was coming from home through Prakriti Nagar, I could see, being the Sunday, you see the entire animals are slaughtered on the road. So where is the implementation? Where is the problem in implementation? And so we need to assess what is the a hotspot. Even we do not know where the hotspot will be. It could be even a regular your food animal, point of sale or production or in the transit. So that, the concentration should be more on not just, though the environment is again, it's impacted by all the pollutions. So even airborne profiling. So airborne profiling is another area where I think as of now we do not have data. Most of the data we get from the soil or water or from animals or plant. But what about airborne, which can predict these kind of diseases slightly in advance? And in fact, in Mallarity we started working with a company called Sapiens Agro and also a company called Metabix Biotech, an Uruguay-based company. We just initiated this to start with animal farms where that, we are trying to see the load of different pathogens and particles, and then we are trying to extend into the hospital cycle. And, as Dr. Rangareddy was talking, that we should have some kind of concrete structure, a consortium, not only at the state level, but I would say at district level. Because, state level, again, sitting in one place and, it's very difficult to control what is happening on the field. So there should be a consortium which should at least see put to the district level, which can collect data from the district, and then that can be converged into one database at the state level. So these are all very, we have also conducted a program, especially for AMR. And, though we had participants, each of the participants had data on their own, one from animal source, one from human, another from wastewater. But there is no single agency which can definitely converge all this and put it in a network. So we need a single network consisting of multi-stakeholders. That should not be at the state level, but at district level. I think this forum can probably initiate such model for the state of Telangana, so that this can be replicated to other states. And since our MD Bairak is there, I think they got a already policy going to set in. So this is my point of view. And of course, thank you for the time. Yeah, thank you. Thank you for the opportunity.
Thank you. Let's go to Dr. Dharmavir.
Thank you. So when I saw this title that was sent to me by Bindu, I thought it was very interesting. So it has biodiversity, it has surveillance, and it has health risks, right? So if you're looking at health risks from the OneHealth perspective, we probably have to look at health across the board, humans, animals, and the environment. And subsequently, you're looking at loss of biodiversity and surveillance. I would ask you to maybe remove your hats, disciplinary hats, whether you're a physician or a veterinarian or a biotechnologist, and say maybe we have to break down the silo between biodiversity and surveillance as well. So surveillance is not just of pathogens. If you're looking at OneHealth, you also have to monitor biodiversity, and that becomes part of the surveillance because you're looking at drivers of the next pandemic, if you're going to take that example, or for AMR as well, that would hold good. So that was my first point. So maybe we have to, even the training that we come through, there's a lot of silos we need to break because we are trained in a certain way to look at things. The second thing I wanted to bring up was to just build on Dr. Reddy's point about the quality of data, surveillance data. And I think in this thing, not only in India, but across the board, the quality of data in the OneHealth realm is not very good and not very utilizable if you want to look at it across different scales, especially at the global scale or the Indian scale even. And one of the reasons for that is the lack of equity. There's certain amounts of data and certain amounts of funding in certain regions within the country or within the globe. So you have a lot of data lacunae around. And in terms of interoperability also, certain disciplines collect metadata, some kind of metadata, and other disciplines collect other kind of metadata. So when you're trying to put all of them together, it becomes very difficult. That's a technical issue we need to change, or we need to at least try to visualize as a problem that needs to be solved if we want to use the data together across the OneHealth approach. Where India can come into play here in terms of this approach is we have a very strong digital ecosystem. Maybe not in OneHealth at the moment, but across the board. Compared to Europe, compared to the US, our digital ecosystem, if you look at the financial sector, it's used across the board. You can have UPI, even a beggar has a UPI here, right? Or an auto driver has an UPI, a doctor has an UPI, a policy person has an UPI. So everywhere you have UPI. So that kind of ecosystem I haven't seen in France, I haven't seen in the US, that kind of interoperability. And if we can learn from those lessons and put it across to OneHealth, it's possible. I think that's something that India can bring to the table. So innovation and digital ecosystem. And in terms of institutional mechanism in which maybe policymakers can bring about change or behavioral change in how people look at policies or develop projects or develop grants or develop research, funding plays a very important stream there if you want to break down barriers and silos. At the level of funding, whether it's at the international level or the national level or the state level, if you have certain policies that say, okay, you have to look at it from a holistic viewpoint and only then you get the money, there are certain conditions that need to be met. You are bringing about behavioral change and making them look at it through a OneHealth thing. That's a very powerful tool. If you mandate multilateral institutions like the WHO, like the World Organization of Animal Health, FAO, and UNEP, if you say, this is not just the funding for WHO, but if we give you this funding, you have to talk to the other people, that's a very powerful tool, and that holds true at the central government stage in India, and that holds true at the Telangana state as well. Funding mechanisms, the way you develop policy, institutionalized policy there can make a huge difference in how you bring about behavioral change with OneHealth down on the field. So in terms of quality, one thing that we could just one final point is certifications. OneHealth doesn't have certifications. The term OneHealth is used all over the place. For good reasons. Sometimes researchers use it because it improves their grant gaining abilities. Then policymakers use it because they want to do something in OneHealth. But maybe if you do have a certification process, you might improve the quality of data and eventually improve the interoperability of data. Thank you.
Yeah, 2 minutes starting now.
Yeah, thank you. Thank you for the time also. Okay, so there is a lot to say and a lot has been said already. I have very few points. Maybe I will start with surveillance again, as being worked in the field for many years now. So when we are talking about surveillance, we are talking about various forms of surveillance, right? Like starting from traditional public health surveillance, then we have wastewater surveillance, digital surveillance, genomic surveillance, and then there is animal surveillance, right? So I quite agree with you, sir. Like it has to come on same platform. But having said that, we have been working on studying various surveillance systems last 3-4 years, doing secondary research, and we just started with seeing what are the indicators different surveillance systems are using for assessing their own system, like where they are actually. So there is a huge difference in each of this system. When we talk about animal surveillance, when we talk about public health surveillance, wastewater surveillance, and they really don't talk to each other at all. And when we want to maybe put them together, it will be very, very difficult to on which particular indicators we are going to assess their efficiency. We are going to suggest this is how you are going to improve or this is how you are going to come together. So since last 3 years, what we are seeing is it's very, very difficult, as sir or rightly said, AP, he has tried also. It's very difficult to bring them together. So eventually we have come to the conclusion that, okay, not maybe together right away. That will be a far-fetched dream. Maybe next 5-10 years it may take for whole countries and not for the state. But at least can we do something that they will start talking to each other. Each system should start talking to each other. There should be repetitive dialogues like this. I'm seeing like agriculture is there, veterinary science is there. So all the field come together, talk to each other and see how the data can be generated, which should be interoperable, as you rightly said. So how that can be made possible quickly, because bringing them on the same platform, it is going to take time. Having worked in, again, like sir is sitting here, having worked with ICMR and central government for last 10 years, they also don't talk to each other. Like I have worked very closely with NCDC also. So it's very difficult like to make people sit together and adopt each other's system. So that can be one of the solutions. Let's start discussing, like we are talking about Telangana. Can we bring various players together at regular intervals and see how they can share the data? So that can be one of the possible solution, or maybe a starting point at least to start this thing. Second point I have is, as I think core chair and chair, someone has mentioned, I guess, that the tribal people, like how they are living, how they are preserving the environment, living with animal. At the same time, they are like surviving as well. So I'm currently working with a very primitive tribe in Telangana. Just to give you a small example, they don't drink any milk. Okay, they all have the animals at their house, but they don't drink any milk. Okay, so this is just a small example. So how they are preserving their own ecosystem, how they are utilizing the ecosystem and surviving. So that needs to be studied. So that needs to be studied in a point of view of One Health, like how animal and human interface are interacting with each other, as well as with the environment. So maybe that can be the second point. And just to give another example, we recently, this month only, we have conducted one more, again, panel discussion, again under our platform of GLC for HSR, along with IISc Bangalore. So IISc Bangalore has developed one village, sir, that is a OneHealth village. So they have, Dr. Professor Tatu is there, so he has a very specific village which work on concept of One Health. So maybe we need more of such examples where we can maybe go study it and take that learning forward. Otherwise, we will keep on reinventing the wheel, and maybe as now we don't have much time, so we will not have much time there also. So let's go and maybe learn from which already exists, and how we can maybe learn from each other very quickly and do this very quick fix. So that's it from my end. Over to the chair and co-chair. Thank you.
Yeah, we'll open it for 5 minutes or 3 minutes, as Bindu says. Quick comments. No quick fixes, okay. Long-term fixes. But I'll invite my colleague, Dr. Ram. He is the program director at BFI, and he has been leading some initiatives there. Ram, 2 minutes for you.
Thank you, Satya sir. BFI, as you, Satya sir said, is also privileged in a way that we have both the ends working together. It's a convergence in itself, where from the lab to the ground and to the policy, that's the whole idea of how do you bring the idea what is the problem statement in the ground to the labs, and what is the solution in the lab to the ground, and see the public, the fit, whether it works or not. Something that we realized, especially from the primary care point of view, we are not ready yet for One Health, preparedness per se. Another thing is also the solutions which needs to be tested are not being tested in the ground. So then that gives us a lot of opportunity from the startup world, from the incubators, to actually test it in the ground what's happening. So currently we are also partnering with UNDP in One Health in 2 districts, one in Tamil Nadu and also in Telangana. So we are really looking forward for the learning. And we are also supporting in Meghalaya, the State Health Resource Center. They're doing fantastic work, especially in terms of building surveillance system, not just with the health, also the animal and zoonotic diseases. Another work that really what we are trying to do is build a platform at the district level where all these people converge, because that's where the real action happens. Anything above district is the policy level where we think, but action happens at the ground. Unless we really strengthen that, it's just going to be just the talks. So yes, Satya sir, thank you so much. And Dr. Gaurav, if he wants to add something to this.
Anybody else? Okay. Quickly with Dr. Gaurav and then Professor Karthikeyan. One minute.
Thank you for this. So we have been working in OneHealth since our inception. We did the largest COVID genome sequencing drive with the help of Strand Life Sciences. At one time, we were contributing about 15% of all the genomic sequences that was going on. Secondly, we also did a project on wastewater surveillance in 2022. But the major thing, if as a funder I may think of, is the fear factor. I am always worried about what my data will be perceived by the government as, either be it the state government or the central government. And once this bottom line comes in my thinking, it's very difficult to go ahead. The second thing, as a doctor who is working in a medical college, a simple thing like reporting of the certain diseases, I'm afraid, because if I report that disease to the district authorities, maybe my hospital can also close down. So there's something to be done to reduce the fear factor when we talk about OneHealth. And when we can do that, I think the organizations like us, many hospitals where I am working also, can contribute a lot to this.
Thank you, Dr. Gaurav.
I had 2 points. One relates to what
closer to your mouth.
One relates to what the chairperson initially said, that there are very important organisms that are in the environment and they can report to us on the state of the environment. So I think we have to designate sentinel surveys, sentinel organisms to be surveyed. And it can vary from place to place, but what are these sentinel organisms? And then comes what Professor Atul Kaul also mentioned, is about important habitats, like water he was saying is very essential. So sentinel habitats, if it is fresh water, you had also mentioned about a source of water that's going to get depleted and what are the consequences downstream. And the third thing is sentinel communities. I think Doctor just mentioned it, and the people living in close association with the environment, probably dependent on natural resources, they are going to be vulnerable. So if we make this structure to reporting OneHealth in the environment, it's a very significant improvement. The second point that I wanted to share, it's a sort of an experience. Me and Dr. Narang here, we had proposed a project on OneHealth, and I feel that there is a lot of diffidence in taking cross-sectoral collaborations by any funding agency. We had submitted a project to ICMR and we never heard anything from it. And it was involving veterinary institutions, clinical human health institutions, and CCMB, like a molecular biology institution. And it didn't see the daylight at all. So I think there is a lot of diffidence on the funders to go beyond sectors and think of them as the first stepping stone to achieve anything on OneHealth. That needs to be removed, or that fear needs to be allayed.
30 seconds.
I'm already done. Thank you very much. Very quick point. I totally agree with Dr. Vasudevan that there is a lot of reluctance from funding agencies, including governmental funding agencies, to look at anything which is abstract. And it had to be abstract when we are talking about OneHealth. So my request to IKP, BIRAC, and other organizations is, let us work on what are the priority areas where the innovators and the startups can take up in order to convert them into products and services, so that we are going to have a better situation than what we are in. Thank you.
Can I add one comment, Satya? With your
Go ahead, you are the convener.
So, 20 seconds. So just to address that, we had launched our virtual global OneHealth incubator almost 3 years ago. The first cohort had 4 startups. They've just graduated. 3 of them wants to continue. We've launched the second cohort call, and Divya is sitting there. Dinome is also joining, so we have a couple of more startups. So we are going in that direction, Dr. Rangareddy. Thank you.
So, the chair came in last night at 11. I was there waiting for him to, welcome. We have half an hour left and 2 more rounds of discussion. May I just request the lead discussants for the next round, which the chair will announce, just spend 3 minutes each rather than 5 or 7, and then we can have open. Unless you want to miss the lunch, and then we can go on for 2. Okay.
Okay, so next one is also very, very interesting. Climate change, agriculture, productivity, and food security, which is the crux of the whole, One Health program that we are looking at. So the lead discussants here is Dr. Kalpana Shastri and Shannon Olson. And then we have expert dialogues, 4 minutes each. So let's start with Dr. Kalpana Shastri. Over to you.
Okay, a lot has been said on climate change and all, and we are also, I don't even have to raise it about it because we are all experiencing. Last evening's rain itself is significant, because if it rains in this area in almost end of October, the rabi sowings are really getting impacted. So we know about that. Having said that, and when I was looking at what Bindu had given, what would be the take for agri and the climate? I think the first thing, Bindu, we need to also look beyond food security, the nutrition security part. I know food security to some people in the jargon it also involves, but if India has to be aligned with the SDG goals, which the 4 pillars are correct what you have mentioned in your note, but nutrition security is equally important, and it's directly linked here. I'll tell you why. Since there's less time, you're in Telangana. There is a particular rice variety called Telangana Sona. Many of you must have been. You're also sitting in the diabetic capital of India. A chance work of a research in the university here in Hyderabad led to the existing Sona Masuri to be with an objective of bringing water-saving efficiency into the variety and reducing the number of days of the crop growth. That was the intention of the agriculture scientists. Fair enough, we used it, and a new variety based on the existing Sambar Masuri came in. It was a chance of observing an article of NIN scientists in an American journal, which pointed out that this variety is also having lower GIF. So today, as I stand today, Telangana Sona is more projected as GI variety, lower GI variety for diabetic patients. And it's a classical example of what you're trying to tell about One Health, because you're talking about ecological systems, you're also talking about water saving, you're also talking about livelihoods. Now, based on that, the huge thing about diabetes, you have 35 enterprises right sitting in Hyderabad who have taken this technology on licensing from the university, and not everybody sitting in this room also are aware. What I'm trying to bring is that convergence, and I'm very happy that Telangana you have taken, because this is the hot spot. You have 7 ICR institutes sitting on huge data of surveillance of all kinds, whether it is microbes, whether it is invertebrates. You have a ornithology ICARPO here, which works on birds, butterflies, not many working on pigeons, which can give you lot of diseases and lot of mind-blowing things for the doctors to treat us. I know a particular institute here which has now developed a cell for pigeon-related diseases to be taken care by their lung specialists. So I'm talking, it's a very good initiative. So 7 institutes working on different, 3 universities here. Everybody should be part of this. I don't know how you're going to stitch it, but it is needed. And last, I'll say, a day before yesterday in the newspaper, everybody must be knowing about Nirmal paintings. I think IKP will be knowing much. It's a GI register. It uses a particular wood, which is only in the forests near that village. And that particular wood, in Telugu it's called poneki, And it's very interesting that a young researcher from the FCRA, Forest Research Institute, has now, the setback was there is dwindling population of that species, which impacts the livelihoods of the GI tag, artisans, which is also having health issues in the sense it's anti-cirrhosis and anti-microbial in nature. The villagers use that, it's an indigenous knowledge. So the research which has come out from the university is to help regenerate the species, break the seed dormancy. It's a tree you're talking. So what I'm trying to say is, if you look at it from the holistic point of view, many agencies coming, and in agriculture, rural communities, which I'm sure she will talk, plus impacting the livelihoods. If these two form part of your thing, along with food and nutrition, climate, anyway we are accepted, we are changing, trying to become resilient. There are so many projects now on heat-tolerant varieties, dormant, everything. Just have the database and try and see what is already happening and not restart everything. Just linking them, the interlinking is required, which can be, and I'm sure we can definitely build. The last point, the OneHealth village. I think it's a really cute, nice idea. All these institutions here have adopted villages. They're all there, the stage is there. Can we bring and build a concept of OneHealth and actually put it into the village? I think Rich can take up that, and we can really make a model part of it. Thanks. I think I'm short.
Yeah. Dr. Shannon also.
Yeah, hi. So thank you very much. Thanks to Bindu for inviting me. And we have heard from so many already this morning about the capacity that we have for OneHealth, not only in the world and in India, but of course in the state of Telangana that we're talking about. And we've also heard a lot about the importance of convergence and getting people to work together. And I want to address, since I run a network, a little bit, how do we make this happen? Because it is really difficult to get people to work together, to share data, to get funders to support us. This is a really difficult thing to do, especially if you're in it. And I know from personal experience how hard it is to get doctors and veterinarians and ecologists and government representatives and CEOs of companies that want to make a lot of money to work together on OneHealth. It's not easy. So think about this. How do we actually get ourselves to work together? So we humans are funny creatures, right? We only work together under really two circumstances. One, when we're scared to death because we're about to, we're facing a disaster. The pandemic's a great example. The whole world worked together, right? And another, when we're truly inspired. I'm an American, and I grew up on the back of the moon mission, right, which was this really wonderful exercise where so many different people got together to try to get us to the moon. Also a little fear involved in that process as well. So taking this from the OneHealth perspective, I see these two opportunities, fear and inspiration, okay? And the first is regarding what you mentioned, climate change. I think we have to change the narrative on how we discuss climate change, because I think we're still talking about it as something that is going to happen or is happening but is not that bad. We are actually in the midst of collapse. And I say this with no reservations. And if we don't talk about this in these serious terms, not to frighten people, but to gauge this reality, then nothing we're talking about here is going to matter. Because we already see it. Dr. Jitendra, you mentioned honeybees. We have an 80% loss of biomass of insects in the past 80%. Imagine if 80% of humans disappeared. We'd be freaking out, but it's already happened. No farmer in Telangana is going to be untouched from the unseasonable rains and flooding that have happened in this state. And we are having thousands of deaths every year from heat stress. So it's here. We are collapsing. So one thing is to take OneHealth from a disaster perspective. We need to approach this from a disaster response and preparedness perspective. The surveillance we've heard about, the food systems, the nutrition, it all has to be taken from this perspective of how do we prepare, respond, and adapt to the disaster, because it's happening and it's going to get worse. That said, we also have at the same time a need to completely fundamentally alter our food systems, because we are still, actually, Indian agriculture attributes 18% of the greenhouse gases, 70% of our fresh water systems are diverted for agriculture, and we continue to use enormous amounts of chemicals in various ways that have enormous effects on our ecosystems. All of you know this. That means we can't just think of, but heat-tolerant varieties and things like that. We have to completely alter the way we grow and eat food on this planet. Why do we eat food? What do we need food for? What do we actually need? So we need to rethink, what does it mean to be a farmer? Maybe a farmer should be actually a technologist, or maybe a farmer needs to become a microbiologist, and a doctor needs to become a nutritionist. We don't think in these terms. We have to reinvent the system for a new world, and India is the place to do it because we have all the expertise here, all the knowledge here, and gosh, we have all of the disasters happening right now. So I think if we frame this in reality, in the extreme terms that it actually is happening, seriously, but also this opportunity to completely reinvent the way we live. That's so inspirational. The work you're doing, for example, it's very important, and we need to do it right now, and we have all the tools we have. And I think if we have these discussions in this way, we can get the funders, we can get the government, and we can get also, a lot of startups and our academicians to work together. So that's what I'll say. Thank you so much.
Okay, so we'll move to the Oh, there's one more expert here, Dr. Jagdish Gupta, scientist, National Institute of Plant Genomic Research.
Thank you very much, Kalpanaji and also Shan. So, regarding linking the food security with OneHealth, because everything is interlinked. Some of the examples I can give is that, for example, most of the India is having nitrogen deficient soils. So, lack of proper understanding how much nitrogen has to be kept in the field, what people are doing is that indiscriminate use of nitrogen fertilizers, actually they are using it. So these fertilizers, what happens is that because of the, for example, if you put this excess of nitrogen fertilizers to the rice fields, denitrifying bacteria and also methanogenic bacteria actually increasing the greenhouse gases. I just wanted to interlink all of them. So when the greenhouse gases nitrogen oxide emits into the environment, it reacts with the ozone, stratospheric ozone, leads to generation of the smog and also nitrogen oxides, etc., which is also actually damaging the ozone layer and also increasing the heat. Finally, the increased heat leads to drought. At the same time, also the glaciers are melting and a lot of unpredicted rainfalls are happening. So all these things are impacting the biodiversity and also the crop yield, etc. So one of the examples is, for example, I have read that excess heat actually reduces the nutritional value of the crops. For example, the protein level, mineral level, etc. So the thing is that so when the animals feed this, actually they are becoming nutrition deficient. At the same time, the people are actually shifting towards taking more carbohydrates, etc., because the nutrients, it is less protein and more carbohydrate, and it's also increasing the obesity. Okay, so everything is interlinked, and also the pollinators also affected with excess of heat, etc. And at the same time, the excess of heat also affecting the pests and pathogens, etc. To mitigate that, people are using excessive use of insecticides, etc. So again, that is actually entering into the ecosystem. So everything is interlinked. We need to actually closely monitor where the gaps are, where we have to focus on, and developing the innovative solutions in order to, in order to have a holistic approach to protect the ecosystem and also OneHealth. So, thank you.
Okay, thanks. So this session ends here. Because of the paucity of time, we'll just move to the last session, which is data integration across sectors. Again, it leads to the actionable items, and because this is the crux of the implementation plan that we can think of through data integration. Here the lead discussants are Dr. Rahul Narang and Mr. Raghavendra Rao, and then we'll go for expert dialogues. I think that because of the limitation of time, we will just shrink the discussions to First lead discussion, maybe we can just wrap up within 5 to 6 minutes, and then expert dialogues within 10 minutes.
Okay, thank you so much. 6 minutes is too much. Okay, so whatever we have talked till now, we created one model which we call as OneHealth constellation model, which has OneHealth in the center, human, animals, and environment on the sides, agents and vectors, and then climate change, vector-borne diseases, biodiversity loss, contamination, pollution, and zoonotic diseases, as well as AMR. And we need food safety, security, supply, disease surveillance. Everybody is talking about outbreak response, newer VTDs, animal vaccines, pharmaceuticals existing and improved, and we need many partners, microbiology, entomology, biometeorology, geology and ecology, hydrology, agent-based modeling, anthropology, ethnobotany, media advocacy, and we have to decide on the priority diseases and curriculum development. And believe me, we have everyone on board in AIIMS Bibinagar and as our partners as well as collaborators. And we talk about human health system and policy, animal health system and policy. Basically, we are talking about economy and biosecurity, and these are international partners, and these are national partners, including regional coordinator of OneHealth that we are. So you can fit in any disease, AMR, rabies, or whatever you wish which involves, and you will create a system of its own. So systems-based approach. And these are OneHealth mission. I'm actually expert to PSA office for OneHealth. And these are all different partners, collaborators, ministries, and we being academic institution are there. And from NCDC side, we are regional coordinator for OneHealth. And somebody had talked about district level and block level and village level. So we have committees at every level. And Panchayati Raj institutions, and this is how the government systems are now talking to each other, because we got World Bank funding and now they want us to talk to each other. So this is how NCDC and ICMR, they are talking to each other right from the bottom till the level of Ministry of Health and Family Welfare, and Indian Council of Agricultural Research is also partner to that, and NIE is building platforms, and National Institute of Virology is working on all these aspects. So like Sir talked about surveillance and sentinel surveillance and wet markets. So we are actually doing a study in 3 states, Punjab, Assam and Telangana, where we are working with slaughterhouses, 2 slaughterhouses, and then some other private players also. And this is how we work. So all this data is being fed to a dashboard being maintained by National Institute of Epidemiology and Indian Council of Agricultural Research and Indian Council of Medical Research, and AIIMS are our partner along with other universities. And this is our slaughterhouse dashboard, because now we are talking about data talking to each other. So we have, now since we are medical institute, so we have all this data, and all these slaughterhouse workers are under surveillance for the next 3 years. And this is what data management talks about: individual workers, then their baseline data, their incident case data, and list of slaughterhouse workers, and animal information, as well as environmental information, and triangulation of data. This is the most difficult part, where everyone talks about but nobody is doing. So we are actually doing triangulation of data along with ICMR and National Institute of Epidemiology. And then we are also working with like sentinel surveillance of zoo workers and the diseases in the zoo workers, along with, and this is what we are talking about now, developing a OneHealth ecosystem for Telangana. We call it as the Eco-Risal Network. We copyrighted this term, and we have OneHealth initiative for this, where we have actually created OneHealth demographic surveillance system in at least 4 villages, where both veterinary and CCMB as well as human partners are there and other experts are there. And digital health initiatives, we use E-Sanjeevani for whole of Telangana. All the sites, around 1,213 sites across Telangana are registered to that, and Ayushman Bharat and drones and public health initiatives, like I talked about, OneHealth surveillance system, and we link PHCs to AIIMS Bibinagar and holistic health initiatives, including integrative medicine and tertiary level, and we are actually building a BSL-3 laboratory there, and we talk about not about disease but about health. So we talk about salutogenesis and contemplative practices also. So E-Sanjeevani.
We have to move on.
Yes, sir. Finished.
Yeah.
And this is what particularly vulnerable tribal groups we are talking about, and at the interface of wildlife, human, as well as animals. So this is one project which we will start working on, and we will leverage digital technology as well as volunteer networks along with NCDC. And then we also train people. Somebody was talking about field epidemiology program, so we are partner to that, and we also have OneHealth Fellowship. We call it Sector Connect OneHealth Fellowship. Thank you so much.
Wonderful. Thank you, Dr. Rahul. Can you move to the next person, Dr. Raghav? Okay, Raghav.
Sure. Thanks, Satya. Yeah, so I'll quickly talk about, I really like the context that Bindu shared for this, which is about data integration. It's not merely about policy, but it's also about the trust that needs to be built in for different departments to share this data access continuously and to get a real-time shareable platform, but also something that provides, real-time actionable information as well. Shannon was talking about we are being in the middle of disaster. So that's sort of what's informed our climate and health investment thesis. So I'll give you a couple of tangible examples of what we're doing, and perhaps maybe we could figure out how to appreciate that post this as well. So one of the projects that we're supporting is called the Climate Health Vulnerability Index. This is being developed by an organization called Khushi Baby in the state of Rajasthan. What they've done is they've, over the last 10 years, collected granular village level public health data. So they have all of this public health data at village level across 40,000 villages in the state of Rajasthan. And they're essentially the digital health arm of the state of Rajasthan. So on top of this, now they're layering on climate data, climate stressor data, so from temperature, precipitation, air pollution data, etc., to see and use both of these data sets to predict future disease outbreaks. So how could heat waves impact pregnancy outcomes? How could precipitation changes impact vector transmission and also vector-borne disease outbreaks? So that's something, and this is very important. And we've only funded this. Normally my funding thesis is we look at solutions that are near ready, so be it diagnostic solutions or digital health solutions. But in the case of climate and health, we've taken a more early approach where we still help allowing them to develop this, because this is co-designed with the state of Rajasthan. And that's super important, because only then will the department later be using what they've developed to actually make an actionable insight. And somebody was talking about the district level action, and that's baked into this, where the district level action plan will be taken first, and then policy moves on to the state level. The other example I also wanted to give you is by the Artificial Intelligence and Robotics Park in the IISc in Bangalore. They've developed a dengue intelligence engine where they predict dengue 2 weeks in advance. And as you know, Bangalore has a dengue outbreak almost every year. And they're currently working on, with the municipal corporation in Bangalore, where this dengue prediction engine will work in tandem with a citizen breeding source reduction app that the citizens and health workers are geotagging these, and then both these data sets sort of speak to each other. And then Clinton Health Foundation is helping them develop an adaptation plan, not just from the public health side, but also to involve private health, like the diagnostic networks, the laboratories, physicians around the area, to see. The idea with both these models is, for example, in Rajasthan, we're funding the development, the validation of the Climate Health Vulnerability Index, and also the scaling up of across the state of Rajasthan. Now, this needs to then be replicated across other states, contextualized for the specific problems that are in those states. The next two states will be Karnataka and Maharashtra. I'll give you a more local example as well, lastly, which is in Hyderabad, we have a company called Track It Now. They developed a mosquito trap-like device that is set up, and inlaid the air is an attractant which attracts mosquitoes, and it can be set up in a community. There are infrared sensors that identify these species of the mosquito based on the wing beat frequencies of these mosquitoes, and that information will go to the infection control folks real time, so that you do more targeted vector infection control. So if these kind of technologies are using the dashboards like somebody like Khushi Baby is developing, somebody like Artpark is developing, where we allow for these machine learning algorithms to learn, be refined, and new sort of, people who are talking about different departments, the need to speak to each other. As data sort of flows in and this continues to be refined, the engine becomes better. We not only deal with the problems that are in the now, but we also prepare for a more informed surveillance engine as we go forward. So that's, I think, the approach that we'll need to take when it comes to data integration. I'll pass this on.
Yeah, we go to the expert.
Thank you. So I just want to highlight two things. One is about data shadow areas, in the sense that we are picking up things which are coming into our area of interest or detection very late or probably ineffectively. So an example is an entire group called funga. There are many new emerging fungal diseases. WHO has already listed 19 new emerging fungal diseases. And they are resistant now to azoles, the most available antifungals. And why is that? Like what Dr. Kalpana was saying, we are using a lot of azole pesticides on plants. And the azole resistance is coming into the funga and it is infecting, it's setting into human pathologies. So that's a complete data shadow area. There was a major outbreak in Denmark, and there was many people in the ICUs who are immunocompromised died, and it became a very big problem. And then people detected that it was a funga that's found everywhere. And then it came into the hospital and it just spread and killed 20 people. So we are not even touching on the areas where our awareness is limited. We are not even expecting some things like that to become the next pandemic. We're looking at virus and bacteria at best and doing a very rough screening of wastewater. And the second aspect that I wanted to say is about data completeness, data accuracy, and data interoperability. Data completeness comes from this shadow area that I told you. There is a huge shadow. We don't know what is there in that. That needs to be accounted for, which means we need to have good curators of data. Right now, data is being dumped actually. And people are quickly analyzing something of their interest and just putting it in some 10 TB, 20 TB hard disks and lying there. And there's no curation. Where are the mistakes? What have we done wrong? Or can we improve it? The same pipelines are being copied from one sector to another sector without even thinking whether it is going to be useful. So there is no curator of this data. Accuracy. Dr. Hegde clearly pointed out, we are doing surveillance. Where is the prevalence data? How do we know that the infection is the cause of the detection of the pathogen in the cell? There's really no prevalence data to correlate it to surveillance information. And that was evident during the pandemic, where governments were hesitant to even share the surveillance data, because that would trigger some sort of a panic. Then interoperability. OneHealth is not a political, it's not restricted to political boundaries. We are struggling with intra-government sharing of data or collaborations or working together. What about inter-government? The trade is the major trigger of spread of pathogens, and we have no mechanism to share data first within government sectors or within platforms that are shared within the country. And how do we take it to the next level? An example is the OIE data sets. India's reporting on many diseases is woefully poor. Notifiable diseases, this is available online, anybody can Google it and check. We don't report on our own diseases, and for reasons which are purely for economic reasons. We want to export our stuff, and even if there are outbreaks of FMD, and we don't report it because our exports are going to get affected. So I think there is a lot of introspection that needs to be done within sectors on reporting data accuracy, data interoperability, and data completeness. Thank you.
Just taking forward what Professor Narang mentioned and what Professor Karthikeyan mentioned, I think data, NIOH under the PSA initiative is already managing this dashboard. And what needs to be done is to strengthen this dashboard and spread it across all the various ministries. And one point which hasn't been yet touched upon is creating a structured awareness campaign around this. So that is again very, very important. So what we are missing is probably OneHealth we discussed, but as in, for example, BIRAC has supported thousands of innovations, and many of them have a lot of overlap across all of these OneHealth sectors. But have we really mapped them with OneHealth? No, we haven't done it yet. So this data integration requires a lot more structured effort from across all the ministries, departments, and a lot more energies into the data curation and shadowing needs to be done. And creating awareness, structured awareness around OneHealth concept, and in an easy to understand language so that it reaches to the masses, it reaches to the kids. The way it happened during COVID, I think everybody knew what a DNA vaccine means, what a RT-PCR means. But we don't want another pandemic to be there for general masses to understand what these words really mean. We can be more in a preventive mode than in a reactive, than to be always been a responding mode. So let's create more, talk about it all the more in a more structured manner, coming from the comms head background as well. I feel we need to do a lot more towards it. So I'll just pause here. Thank you.
Arvind? Yeah, so I'll just share two perspectives, both from state and central initiatives. So I think we have been talking about the intra-government departments speaking with each other, etc. So one successful model that happened in Telangana, state of Telangana, in the last 8 months, because there's a Telangana AI roadmap policy that was launched in the month of September, and post that we were able to coordinate, we meaning I am speaking on behalf of the state and different departments under the state, be it RICH, ET-Wing, T-Hub, etc. So we successfully coordinated with 10 to 12 departments, be it health, agri, as well as transport department, and we were able to come up with this portal called as Open Data Portal, which speaks about what's happening in the state of Telangana, what's the nutritional status, how many women are enrolled in the Anganwadi centers, as well as in terms of the agri, what's the climate temperature in the state of Telangana. So such models, I think it would really help innovators, a lot of researchers, whenever they lack access to the data. But yeah, one question remains the thing, what's the sustainability of it? That's where I think investments from private firms could help both the innovators and researchers, because when it's to do with data, obviously there's a lot of protocols that are associated with it, as well as how do we incentivize it. And yeah, that's a successful model from the state that could be replicated if we are looking at a OneHealth kind of model. And from the center, I think ma'am had pointed out National OneHealth Mission Dashboard. Last year only, I think this had been come up, and in the month of June 2025, National Health One Mission Dashboard had been initiated, where you will be, if you log into that dashboard, right, you will be able to see which state is working in the OneHealth and what are their initiatives, and similarly what are the central schemes that are existing. So yeah, awareness is a major issue. I think such dialogues could really help. And yeah, OneHealth hackathon also has been launched by, I think, Office of PSA recently. So yeah, and at RICH, we also work with several hospitals, let's say 22-25 hospitals, and yeah, Ayushman Bharat Digital Mission, I think it would give us a roadmap for such initiatives too. Thank you.
Thank you. There are two practical aspects that I want to discuss based on all the discussions we're having here, which also points towards the two lenses with which Genome is working in OneHealth and the gaps that we identified while we were working. One was, we talked about ecosystem services. Satya, I think you brought that point up. We look at OneHealth as host versus pathogen for diagnostics specifically, where everything that is giving ecosystem services to humans, animals, environment, plant, agriculture, everything, we consider them as host, and anything else that disrupts that in terms of disease and other things are pathogens. And we've seen that the decrease in biodiversity of host species invariably increase the molecular diversity of the pathogens. And a practical example of that being is that we were actually, we developed a kit for Vibrio parahemolyticus for aquaculture, and we developed a kit for Mycoplasma synoviae for poultry. And we did, we developed it in-house with control like organisms that we got from laboratories who had cultured it from the field and have been maintaining them as laboratory cultures. And then we saw that the strain in the field for Vibrio parahemolyticus was completely different than what was there in the lab that we used as a positive control. And then for the Mycoplasma synoviae, the interesting part was the strain that was infecting the poultry in a large farm where you have a closed kind of a poultry farming culture was completely different from the one farm which uses an open system which is right near an aquaculture farm. So we realized that there is a huge dearth of resource, and that's what data Karthikeyan sir and many others who have pointed out today. We don't really have proper resources to even build something on top of it because there's no data. There's no data available on what strains are actually indigenous to India. And that's where the second lens comes into being. What we look at is, instead of a top-down approach, we're not saying that that's a bad thing. Like, we do genomics, we do sequencing, and blindly look at all the diversity and then try to identify which are the possible emerging strains. We took a bottoms-up approach, thinking that we need to look at this as a very localized problem. When you're looking at aquaculture and poultry in a farm, which is side by side, we have to look at the strains and do a surveillance there and identify the strains there from that area and create a database system of that, compared to some other area where a surveillance is happening, which is where the sewage versus aquaculture water was one of the things that we were contemplating when we were starting the work. So this is something that we can think about. Thanks.
Thank you, Divya. 1:15 already. So what I suggest, I've already discussed, and he's approved it. You know, he's MD Birac, so he's got to do the approval. Is that we'll just request Dr. Sridhar Kotakotav from Indian Immunological 2 minutes, starting now. After that, I will spend 60 seconds to wrap it up, and then I'll give the final remarks to our chair. And because he's the chair, he can take as much time he wants. So who hit that? Dr. Sridhar.
My 30 seconds gone, I believe. So I thank you very much for giving me this opportunity to speak out. As Indian Immunologicals, we are, one health company by nomenclature we come into this, and we are very, very much closely working with our OneHealth organization, which is existing in Nagpur, and we have a lot of BIRAC-funded programs going on. So we have one new initiative about the aquaculture. So Indian Immunologicals, due to the lack of regulatory guidelines, we took it as a challenge, and we drafted the guidelines, and we have provided this to DHAD to get these guidelines, because in Indian Immunologicals, we take the proof of concept to commercialization. If we need to launch a product, we need to have proper guidelines. So for this, we have to have proper data monitoring system, and this is my experience. Right now, we are working with our Indian governance to make a policy ready for the aquaculture. Thank you so much for this opportunity to speak out here.
Thank you. Actually, stuck to time, so one of the few people who did. So 60 seconds from me. What an amazing discussion here. I think it's been recorded. I don't know whether it's been put on YouTube. Don't know that, but I think we should definitely make the best of what we heard. Many things stuck in my mind. I'll just, without naming names, somebody mentioned surveillance is not same as prevalence, so disease burden. I love the idea of sentinels, not just from species level, but sentinels for communities and all that. And then moving to how data sometimes generates fear factor in the government and therefore not reported, right? So that was a great point for me to take home. And then, obviously, how do you look at data shadow areas? And this is, I heard of rain shadow areas, but data shadow areas is a great concept to work on. And of course, many others. What I think finally my take-home message was, how do we find Nandan Nilekani for OneHealth in India? Who somebody said about digital governance and digital payment, and Nandan ji just changed with what he built with his team. So something for OneHealth can be thought through. So leadership is very important. With that, I thank you all from my side. I will leave it to my chair, Jitendra here, to give his remarks and then close this round table.
Thanks, Satya, for actually summarizing it and easing my job. However, I would like to give a snapshot of each session that we had and what are the takeaways. It's not possible to cover all the grounds because its time is very less. However, I'll just focus on few things which are very, very important in each session. So let's talk about the first one, loss of biodiversity, surveillance and health risks. The most important points came to the forefront is the loss of clean water and air, the medicinal plants, the infection, increases. These were one of the important factors, important key points that came from this. The other things related to the policy was funding the consortium is always better. And, CSR funding, nature-based solutions, positive incentives, etc. have to be given for OneHealth initiatives. The other things which came from this session was there is no universal system for capturing the data for all the sectors, and therefore we must have some kind of a universal system for capturing the data. Then we had an importance of airborne profilings being one of the things which is neglected so far, so that has to be taken care of. Then we had quality and surveillance data, which is not very good actually. The quality of data is not good, which needs to be augmented. The interoperability of data is also an important aspect. And then we had one important point made in this session was the fear factor. Because sometimes doctors fear that reporting a new disease, etc., is something that can backfire. There are backlashes from government, which is, I think, very, very important. We need to have the right systems in place. Somehow we need to take care of this. And also in this session, it came out that biological indicators and the sentinel organisms are important, but their sentinel communities also are important. And for cross-functional, type study, we need to take into account these type of these sentinel communities also. So these are the takeaways, and briefly on the first session. And I think it was we covered a lot of grounds, and definitely somebody who is taking the notes from the organization side should compile it into a meaningful, para, so that it can be sent to BIRAC or, and we can also work on it. My team can work on it to create a, more polished paper, and then we can work on it as a frame of reference. So this is very important. Now, going to the second session, the climate change, agriculture, productivity, and food security. So this was again, as I said, is the crux of the whole, program. And here, we talked about nutritional security being equally important as food security, because you can grow crops, but if it's nutritionally deficient, then it's not going to help. And there was also, pointer from the research point of view that if there is a heat or climate change happens, then the nutritional nutrition of the crops gets depleted, or it's not as highly nutritious as it is. And then the one important also point mentioned was that the whole thing, One Health program can be driven by fear factor and the inspiration. So because the calamity is already hanging around, and we must make awareness, or we must make people aware of this, and that is a fear factor which can unite. That is the most important thing, because whatever said and done, it's not coming, nobody is taking it seriously actually. So the fear factor can take it seriously, and more awareness about this fear factor. And the second was inspiration. So definitely, if we can inspire people to work together and come together. It's so difficult. It was mentioned by many people. It's so difficult to make people work together, from animal health to doctors and environmentalists, etc., to work together and share data is very, very difficult. So these were the takeaways from the second session. The third session was also very, very important, data integration across sectors, because here the main action happens actually. Most of the data originating from the various initiatives have to be combined together to make a meaningful action. And here we got a concept of One Health constellation model, which I thought is very, very important. And trust building measures for sharing the data is again very important, because that is something that we observe all the time. We ask for data from different people, we don't get. Then data shadow areas, that concept came, and I think this is a new concept also for me, where the data is weak actually, and it's coming late or inefficient, etc. So these all came, and one example, very prominent one, came as a new disease, which comes into fore when there is a climate change, and the example was for the disease resistant to azoles because of pesticides being used. So there could be several such examples actually, which must be documented. Apart from whatever we discussed today, I would urge the organizers to actually document some of the disease which have actually emerged because of the climate change or because of the loss of biodiversity. So because that can act as a case story for us, case laws for us, or case, we can say case history for us. How to understand the whole mechanism, and where are the interventions that we can do to break this cycle. Then the other important points came out from this was open data portal has to be made, which is very, very, very important, which I think BIRAC will also help in, and mapping of innovations along One Health. We have so many innovations, but how does it, impact or intervene in the health? One Health we have not done it. So I think BIRAC also should take care of this. My team definitely would prepare this kind of mapping. Structured awareness is very, very important, because if we cannot inspire people, whether from the fear, out of fear, or the inspiration, because we have not a structured program of awareness. So, because many people may not even know that this is an impending danger. So unless we make people aware in their own languages, there are people who may not understand One Health. When I joined incubation movement, people did not understand what was incubator. Whenever I used to go for lecture, they say incubator is something we have heard, there's an egg which is hatching, etc. and all that. So it's okay. So I used to tell, okay, the idea, where idea hatches, then we say. So similarly, we have to make it simpler for people to understand what is One Health and how you are impacted, and where. So general awareness of the whole dynamics in a simple language, and in many regional languages as well as within regional language also there are higher little traditions and higher traditions in society. Suppose this is a higher tradition where we are talking intellectually, but same thing we cannot talk to villagers. We have to modulate our talk and discussion. So those are little traditions of society. Both are important. I'm saying high and little doesn't mean actually literally. Both are important for keeping the society together. And lastly, there was also mention of evolution of species in the biodiversity zone compared to the laboratory area and all. So how does gene transfer happen, horizontal gene transfer, etc. So the example was given, and I think we must document those also. So I'll end here. It was not possible for me to actually cover all the grounds because it was very enriching discussion. I myself got enriched. I myself got a lot of learnings from this, and thank you so much for all your contribution and participation. Thank you.
So I think one thanks. Today is Sunday, all of you came. He's actually rushing off to north of India for another engagement. But this is a Sunday, great to have you all. A big round of applause for yourself. But Bindu and her team who put everything together for this to be a success. Big round of applause to her as well. Shall we call it? Yeah, I think so. Shall we call it a close? Do you want to close it?
No, please close it. I just want to thank both Dr. Jitendra and Dr. Satya for chairing and co-chairing, and all of you to come here on a Sunday. I really hope from the bottom of my heart that next time we meet, we have taken a step forward, whatever step that is, and that we decide together collectively in the spirit of One Health. So thank you so much.
I hope all of you had good lunch and ready for a session. So the lunch is not meant to make you feel sleepy. The lunch is meant to give you energy to discuss CGT convergence, science, scale, and access. I'm not introducing Dr. Jitendra Kumar and Dr. Satya Dash. Both of them are going to chair and co-chair respectively this session. My role would be to just kind of see how it goes, and if there's a requirement, I may step out and come in. I hope all of you don't get disturbed with that. With this, I request Jitendra to start the session. Jitendra, please.
Thanks, ma'am, for organizing this wonderful session. I was there in the first session, One Health, and I could see very less number of people. But here I can see a lot of people. So definitely it's I know, we all know that it's a hot area. So thanks for coming and joining here, this important topic to discuss. In cell and gene therapy is one of the most important area where our country needs to take a big leap, because we are lagging behind, especially in comparison to countries like US and China. We may have emerged as the 4th largest economy, but then the technological innovations and value generation is really, we are lagging behind. And unless we focus on new innovations, I don't think we can become a prosperous country. We may become a middle income country that we are, but to leapfrog into a nations where prosperity is the mainstay, like US and Germany, France, and other countries who have taken innovations in a very, very important way. For example, I'll give US has some, and China combined together most of the clinical trials going on. If you combine these two countries together, most of the clinical trials for the new molecules I'm talking about, including CGT. And India may have some 250 trials going on, which is actually very, very less. So how do we actually leapfrog from here? Some of the government initiatives that we have taken, of course, you all know that, of course, starting from grassroots, we have made sure that the innovation ecosystem is there by setting up BioNest Incubation Center, where startup companies can do a plug and play and do proof of concept. Then on the top of it, some incubation centers like IKP, CCamp, and maybe Venture Center, they have set up some more higher levels of infrastructure where they can do beyond proof of concept, say TRL level 3 and above, 4, maybe 5 also. However, we still have a glaring lack of pilot scale facilities, viral production facilities, especially for CGT. We talk about CAR T cells, we talk about lentiviral facility we do not have. We have to import even viruses in other regions for making this success, and that increases the cost. So innovations can happen definitely at the technological front, as well as cost reduction for our country strategically is very, very important. And therefore, this session is of very, very, holds a lot of importance in having some kind of roadmap, because you all are experts coming from different parts of country, and you all are working in the area directly or support and subsidiary services to this important area. And as a BIRAC MD, we would like to, from the government side, we would like to have these inputs. We like to see how we can implement these inputs, because these are gap areas and areas where we may not be able to map on our own, and that's why these kind of stakeholders meeting. And thanks to IKP for organizing this. It helps a lot to the government to actually frame policies, create. Because BIRAC is not only a funding body. Actually, we have to create programs where funding is one component. How do we create programs unless we map the whole area? So this is one occasion where we come together and map the whole area and see. So from the government's perspective, we have done this, incubation centers, BioNest, and the latest BioE3 policy, you all know, has set again another benchmark from the government side to create infrastructure. And you must have heard about bio-manufacturing hubs and biofoundries, which we are funding to the level of, say, 65-70 crores. Of course, 30% has to come from the corporate side. Many of you have applied. Many of the funding has gone to CGT area, I can tell you. So this will have some effect. But again, I think the area also needs a lot of funding, more and more deep funding, because again, venture funding is again not very forthcoming in our country. So at least if we give, from the government side, if we give some money, say 50% and 50%, then you can raise, showing this, that okay, government is funding, you can raise 50% from others. So that is what RDI scheme is all about. So RDI scheme, is, you must be knowing 1 lakh crore has been sanctioned from Ministry of Government to ANRF. And ANRF will actually fund second level fund managers. Most probably BIRAC will be one for biotech side, where we will be actually funding companies, projects in the deep tech area. And CGT, of course, is one of the most important area, where the 50% money will come from the government and 50%, it's a loan. As of now, it stands as a loan for long-term loans, say 15, 20 years. And the quantum is high here. We are talking about 100 crores and above. There's no ceiling, but, we are talking about, so that part, the value of death, that part we can take care from the government side. And I think this will increase the accessibility of capital also from the private side. However, there's another challenge, which you all might be knowing, is the regulatory challenge. Even if we reach all the milestones, we are at the cusp of producing or launching the product. The regulatory hurdle is so immense that you cannot imagine, especially in emerging areas. And CGT is an emerging area. We don't have a framework, well-defined framework of reference for regulatory framework. You must have heard about ImmunoAct's launch of NextScare 19, a CAR T product for adults. But actually they were trying to launch for children also, but then it got rejected in the CDSU. After all the trials, everything, you imagine the time spent and everything, and then they are again going. So what we mean to say is that unless we have a well-defined regulatory framework, the products may die. It's another valley of death. So government is thinking at a very initial stage, don't take it as something that we are already doing, etc. But I think we also must discuss about regulatory sandbox that we can create in our country. Many countries have done it. It started with fintech, their regulatory sandbox, where CDSU will be deeply engaged with those selected innovators in some specific areas, and then make sure that till the product is launched, they are there, they are guiding. Because what I heard from ImmunoAct is that we were not told earlier to do this. But in other countries, I think there are a lot of meetings with the regulator and the innovators to make sure that things progress in the right way, and they don't have to redo again and again same thing. So regulatory challenges are huge in our country. So many countries have solved this problem through regulatory sandbox. The regulatory mechanisms are very, very strong. US and China, glaring example. And the other thing is the low number of pipelines that we have. I talked about, more than 8,000, and combined if you do China and America, more than 10,000 clinical trials going on. Actually, much more than that, but this is a conservative figure. But our countries, I know, not more than 250 and, to this clinical trials happening. So how to increase the pipeline is another thing that we must delve into. Because ultimately, how do we actually increase the pipeline unless we have a deep tech research going on as a base level? We all know that academic research is happening at a pace which is not, in sync with the number of per capita. If you see, it's very less actually. Thinly, it's a very thin.
To stay informed about the startup ecosystem, subscribe to MyStartupTV.